Hormone replacement therapy involves replacing 2 hormones and sometimes 3 hormones. There are 2 main female hormones. One is estrogen, the other is progesterone. And we sometimes also replace testosterone, which is typically thought of as a male hormone. Estrogen is the hormone we want replaced because it stops our hot flushes and night sweats. But we need progesterone as well because this protects the womb lining and stops that over thickening. If we don't give you progesterone at the same time, that would predispose you to abnormal bleeding and abnormality of the womb lining. So it's really important if you're taking estrogen and you still have your uterus that you use both hormones. In addition, some women who are postmenopausal and have low libido for the most part benefit from testosterone. And this is something we can also trial to see if women find benefit from that. HRT has been associated with a very small but measurable increased risks of breast cancer. And that's the thing most women worry about when they're considering whether or not to take HRT. If you have a family history of breast cancer, then that's particularly relevant for you. This risk of breast cancer, however, is equivalent to many lifestyle factors like having a glass of wine a day, smoking, and it's much less of a risk than, say, having a BMI over 30, which doubles your risk of breast cancer. So I think in many women's minds, this is a much exaggerated risk, although it is measurable. The benefits of HRT arguably outweigh it for most women. So it will manage your symptoms, so it'll manage your hot flushes, night sweats, anxiety, mood problems. But in addition, it'll help your bones, so you'll prevent you getting osteoporosis. It helps your cardiovascular system. You stop the fatty buildup of plaques in your arteries. And often it'll help your mood and your general sense of well-being. Women also notice the skin, the hair is also better on HRT. So whether HRT is appropriate for you will depend on your medical history, your family history, your symptoms, and to some extent your philosophical view and your choice. Some women can't take HRT, and we have lots of other treatments we can offer them also. So it isn't just one size fits all. And what's really important is that you see a medical professional and we individualise your care.